Okay, we are connected.
Good afternoon. I'm Dave Anderson, and I serve as chair of the Master's Level Psychology License Clinical Psychotherapy Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic media. David Stevens disappeared.
He was present, but I'll keep an eye on the room for him to come back.
Okay. We know Travis is not going to be here. Rebecca Jabara,
I'm here. Good afternoon.
it's good to see you. Bruce Johnson is not here. Lauren Luck not here. Iris Pauley.
Hello, present.
Robert Pedroza.
Present.
Jennifer Schreiner.
Good afternoon, present.
Josh Tangway.
Here.
And we know Kari is not going to be here. I note the following BSRB staff members are also present. David Fye.
Here.
Leslie Allen.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or COMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public contact could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting to ensure the advisory committee has sufficient time to handle all items on the agenda. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the COMA are not suspended, so we will be conducting this meeting pursuant to the COMA. On August 30th, 2023, we sent notice of the advisory committee meeting to all individuals who had requested notice of advisory committee meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material were posted on the board's website and are available today for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows public members to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And Lauren Luck is entering the meeting from the waiting room, so she will be present here briefly. Also, the conference call line is active. I did check it before we got started. There's no one on the conference call, but I'll let you know if I hear someone beep into the meeting that way.
Very good, thank you. All right, the meeting is now called to order and the advisory committee will begin its discussion of the first item on the agenda. So our first item will be approval of the agenda or additions to the agenda. Does anyone have any items they wish to add to our agenda? Okay, seeing none, I would entertain a motion to accept the agenda.
So moved.
Thank you, Lauren. Second.
Second.
Thank you, Josh. So we have a motion and a second. If there's no further discussion, all in favor, please say aye.
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 Hands, that's okay. All opposed, same sign. We're getting a little feedback there. Thank you. Motion passes. Well, we were going to introduce our new public board member. Was here for a brief moment and then disappeared. So if David comes back, David Fye, can you tell us something about David Stevens?
Sure. Yeah, David Stevens is a new member of the board. He was appointed by the governor to take the place on the board as a public member that was previously held by John Norton. So his term began in July. I believe he is an attorney. His background is in legal matters, and he has, I believe, some experience with compliance in those related fields. And so he's very interested in getting plugged in. And as a public member of the board, he serves on 2 different advisory committees. And I believe those 2 are the licensed psychology and also the master's level psychology. So he decided he's going to learn about psychology first and be active on those advisory committees, and then perhaps serve on other ones in the future. But really happy to have David Stevens on the board, and he did join the meeting at the very beginning and then had to drop off. So if he's having technical issues and he comes back, I'll definitely let you know so he can share a few words about himself.
Thank you. Is there a maximum number of Davids you can have on any one committee? Seems like we're probably rapidly approaching that.
We have quite a few at the moment. You're right.
Okay, has everybody had the opportunity to review the minutes from our last meeting, August 16th? Or do you need a minute? If not, I'd entertain a motion to approve the minutes.
So moved.
Thank you, Lauren.
Second.
Thank you, Josh. A motion and a second. All in favor, please say aye, or you can raise your hand.
Aye.
Except for you, Josh, nobody can see you. So. Oh, there you go. All opposed, same sign. Motion passes. Thank you. We will move now into the executive director's report.
Thank you, Dave. At each of the advisory committee meetings, I try to share some information on recent happenings with BSRB operations. I try to share some information from the most current board meeting that I think would be relevant for the advisory committee members to also be aware of. And then if there's any other upcoming meetings of note or recent meetings, I try to share that information. So focusing first on operations, we have quite a few changes. And actually, before I go into that too deeply, I did notice that David Stevens is rejoining the meeting here. So once he logs in, maybe it'd be a good opportunity to have him introduce himself to the committee. And David, can you hear us okay? Maybe connecting his audio here. David Stevens, can you hear me okay?
I can now. Sorry, I was having technical difficulties and fighting with Teams and Zoom, and I think I've separated them into their corners, and they're both in timeout now. So, yes, sorry.
No
Well,
problem.
welcome.
Thank you.
Wondered if you might take a moment and introduce yourself. Tell us a little bit about yourself.
Sure. David Stevens, I'm Senior Vice President of Compliance and Associate General Counsel at WellSky, a health IT company headquartered in Overland Park, Kansas. And I'm excited to participate in the board and the committees. Previously, I was at Blue KC for 11 years, where I worked on various issues, including ones around accreditation and licensure for providers. So this seemed like an interesting opportunity to me.
Welcome. We'll take a minute and have everybody kind of introduce themselves to you so you have a better sense of who's on this advisory committee. My name is Dave Anderson, and we just discussed that your joining us means we have topped out on the number of Davids we can have in any one committee. I am the Director of Clinical day job at High Plains Mental Health Center. We cover the 20 counties in Northwest Kansas. I've worked here for 36 years, and I'm on my second term on the BSRB. Welcome. Robert, I'm just going to pick people.
Yes, hello. I'm Robert Pedroza. I work for Centurion. We contract with the state of Kansas to provide the healthcare services for the Department of Corrections. So we work with the incarcerated. Been doing that for 9 years as of September, and my role's expanded a little bit since then. I do a lot of different things. But
Thank you, Rebecca.
Hi, welcome, David. I'm Rebecca Jabara. I'm in Wichita, Kansas. Obviously, I work for the public schools here doing mental health evaluations and consultations with teachers and staff. And I also do a little bit of private practice.
Thank you, Lauren.
I'm Lauren Lucht. I'm the Vice President for Mental and Behavioral Health for the University of Kansas Health System. And have had a lot of fun over the last 20 years, transitioning from 100% clinical to more hospital administration and operations.
Thank you, Jennifer.
Hello, sorry, I'm trying to eat my lunch, so you guys don't need to see that. That's why I'm not having camera on. I'm Jennifer Schreiner. I'm the Director of Outpatient Clinical Services in Hutchinson, Kansas. For Horizons Mental Health Center, we serve 5 counties, mostly rural, 1 frontier. I've been in community mental health for 15 years, have enjoyed it, and so continue working in it. So,
Thank you, Iris. All right, how about Josh?
Hi, David. Welcome. My name is Josh. I'm sorry, my camera's off today because I'm at home unexpectedly with my 3-year-old. But I am the owner of a group practice in Hayes, Kansas. I've been doing that for 5 or 6 years now, and have been on the board for at least a couple years and really enjoy the work. Thanks for coming.
Okay, Iris. How about Leslie? Do you want to introduce yourself?
Me, me, Leslie.
Yes.
Sorry, I was eating my lunch as well. I'm Leslie Allen. I'm the Assistant Director and Licensing Manager for the BSRB, and I have been with the board since 1999. Glad to meet you all.
Nice to meet all of you. Thank you.
Very good. All right. We'll go back to the Executive Director's report.
Okay, thank you, Dave. And David Stevens, I mentioned this right before you logged on, but really happy to have you on the board and look forward to working with you more. And if I can help with the process of your onboarding anymore, or we ever want to have conversations, you can give me a call or reach out to me. I'm happy to help. So in terms of operations, we have, I was just starting to say, we have a lot of moving pieces here at the board office. One of the things that happened earlier this year was the board had requested some changes to legislation to create some new license types, to add some flexibility in the statutes for individuals who are currently licensed to be able to maintain their licensure a little easier, and also to create sort of a pathway for individuals to become part of the licensed profession by creating new student licenses for the addiction counseling profession, trying to reduce costs and issues for people who were previously licensed who want to come back and practice. And so there were a lot of good and unique items the board had requested in legislation. And when that went before the legislature, there were further changes that were made. And so the passage of Senate Bill 131 has been a challenge for us to fully implement, but our staff has worked really hard on that. There were some items in that bill that necessitate a lot more work for certain people, and to make sure that work is being done quickly. And so we asked for authority to hire 2 new licensing specialist positions, and we were provided that by the legislature. That was our best estimate at the time in terms of what we would need to make sure that everything continues to run smoothly. We are still in the process of working out a lot of logistics to put those 2 people into place. We obtained authority to hire the people as of July 1st, and we did create position descriptions, advertise those, interviewed a lot of good candidates, open that up to people outside of the agency and those within the agency. And our two best candidates were internal hires who wanted to challenge themselves and take on more responsibility. So we were very happy about that. And so when we did put those two people into the new licensing specialist positions, it created two more openings. And so we had to do further rounds of interviews. And now, as of a few weeks ago, we are fully staffed. Everyone is being plugged into place. They're learning their new roles and responsibilities. And a lot of that means that current staff members are training the new staff members. And so once they are all up to speed, I think we'll get a better idea of everything functioning and the way it will go moving forward. But part of this too has been purchasing new technology for the staff members, updating some of our existing technology. So we've had IT in here, I think maybe every day for the last week and a half, doing installations of different laptops for employees, running wires through the ceilings and through the walls. We're also limited physically by how much space we have for employees here in our office. So to add two more people, we've had to think really creatively. And so we are in the process of converting one office to a shared office and having both of those individuals who will be sharing it work remotely a couple days per week. We are also in the process of trying to change some of our long-term file storage policies. And so every state agency has a document retention schedule, and our retention schedule said that we keep our records in paper form and that we keep materials for applicants, for example, until their license expires plus 5 years. And then we keep them an additional 5 years and then transfer them to the state archive, which is with the Historical Society. And so essentially we are holding on to 10 years of records after expiration. And right now we have space that we could use for staff that's being held by paper records. And so we approached the appropriate body. I made a request on behalf of the agency to shorten our time frame to hold those records until the license expires plus 2 years instead of 10. And they approved that for us. So we are now in the process of moving 8 years of records to the Historical Society. In doing something that ambitious and aggressive, we had too many files for how many boxes they had available for us. So they had to order additional boxes. And when they got those, a lot of other agencies, I think, are doing similar things. And so we've offered to even purchase some of those boxes independently just to speed up this process. But that is one of those things that's limiting our ability to free up that space and have more people where we would like them to be. So in the meanwhile, we are currently utilizing the boardroom, the conference room itself, for we had it for 2 staff members, and now we have 1 staff member set up there temporarily. And we are trying to make sure they have what they need as far as technology and other things. So yeah, like a lot of moving pieces, but staff is working very hard, learning new responsibilities, and really happy with who we have in-house. And I think we'll have a real strong outlook moving forward. So additionally, I mentioned that bill that passed in the new license types. We were able to roll out most of the items as of July 1st. For the other items, we have been able to offer those since about the middle of August 14th or 15th. Information on all those is posted on the BSRB website. One thing that we did to facilitate issuing those licenses as quickly as possible is that the bill itself established the fee caps for those licenses, but to issue them, we had to have the specific amount set in the regulations for the fees for those licenses. And so we requested authority to do a temporary license or a temporary set of regulations for the fees. And so there's a certain body that approves temporary regulations. We brought those before that group and they approved them. And so we also had a set of permanent regulations for those fees that are going through the process at the same time. And so part of the permanent fee regulation process is that we have a window of time of about 60 days where any individual can provide public comment. At the end of that period, we have an official day where individuals can come and provide additional comment. And we did facilitate that meeting that took place on Tuesday, October 3rd. We didn't have any individual come to the board office that day to provide additional comment, but we had advertised that. And so now the next step is for the board to take a roll call vote to formally adopt the proposed permanent fee regulations. And so that will likely take place this coming Monday at the board's out of town planning meeting. And then if that roll call vote is successful, then the next step would be for us to provide those to the Secretary of State's office. It would be published in the Kansas Register, and then I believe either 10 or 15 days after publication, they become effective. And so trying to move forward on that, but it looks like probably by about the middle of November, those fee changes will all be set permanently. We have some other regulations that are going through a process on a different track, but I'll have more information to share about those other regulations in the future. Unfortunately, the regulation process is not a quick process, and it frequently involves things moving between different agencies for review. Part of that includes review by the Department of Administration. Sometimes it's by the Attorney General's office, and then there are other committees that review and provide comments too. But moving forward, and progress is good. So we're moving forward on those regulations. I mentioned the board's out-of-town planning meeting. Once a year, the board seeks to hold an all-day meeting in person if possible. And so this year, it's going to be in Wichita. Last year was in Kansas City. The year before, the board was under earlier times involving the COVID pandemic. And so we had an online meeting that year that was split across 2 days. But this year, we're going to have an in-person meeting in Wichita on Monday, October 23rd. It is going to be at the Seasons venue at Watson Park. It is open to the public. It'll be from 9 a.m. until 4 p.m. Information on that meeting has been posted on the BSRB website and put out on the Kansas Public Square. But we're looking forward to seeing all the board members there in Wichita and allowing them to have some further conversation on some different topics that involve a lot of discussion or items relevant to potentially the board's legislative agenda. So looking forward to that on Monday. In terms of some other items concerning, well, let's move next to items from the most recent board meeting. The board met on September 11th, 2023. One of the announcements that was made is to welcome the newest board member, and that is board member Jill Flessing. She is the board member for addiction counseling. That board member spot previously was held by Deb Stidham. And so excited to have Jill on the board, and I've started to work with her a little bit, and looking forward to working with her in the next few years as a board member. Additionally, the board had a good discussion on alternatives to an existing rule and regulation that involves individuals seeking clinical licensure that have an approved clinical training plan. There is currently language in the regulations that says if they wish to make a change to those, if they have an approved training plan and they need to make a change, they have to submit that change to the BSRB office within 45 days of making the change. The language currently in the regulation says that if they fail to submit that change within 45 days, they will lose the hours they accrued after that point until the change has been approved by the BSRB. And so the board has had some conversations on that, and I believe the advisory committees have as well. And so that is something the board is going to be discussing further at the board's out-of-town planning meeting. Additionally, a few of the professions allow members of other professions to serve as supervisors under certain circumstances. The current language now, for example, for the marriage and family therapy profession and the professional counseling profession states that individuals from other professions may be supervisors under extenuating circumstances. And the term extenuating circumstances is a term that is defined in the regulations. That is an extreme situation outside of the person's control that would either prevent them from complying with the regulation or make it inadvisable for them to do so. And so the questions that we had posed for the board was whether that test of using extenuating circumstances is the appropriate test to keep in the regulation and how to apply it to some of the existing requests we'd received. And then also it kind of led to a further discussion for some of the professions of, do they really continue to want individuals from other professions to provide supervision to their licensees? Some professions do not allow individuals from other professions to provide supervision, while others allow a great deal of individuals to provide that supervision. For example, addiction counseling. There is language there that allows individuals from other professions to provide the supervision for those seeking clinical level for the addiction counseling field. So I think the board will be discussing that further and hoping to reach a resolution going forward. Also, some of the relevant items from that board meeting, the board is made aware of a recent change to federal law that we're trying to work through with our legal counsel, and a lot of other agencies are similarly trying to figure out. It has to do with the Service Members Civil Relief Act and portability of professional licenses for service members and their spouses. So this was a change to federal law that as best as we can understand at the moment, it essentially says that if you're a military member or a military spouse, it's limited to those groups, and you hold a valid license in a state, and then you are relocating or moving to a new state, this would provide a different method of practice in your new state. So it would be an alternative to traditional licensure, but you would have to provide different materials to the new state you're moving to. And then if you have been reviewed and approved by that state, you would be able to practice in that state under a form of recognition versus licensure. You have to have a similar scope of practice in the state that you're licensed. You have to maintain that license in your original state. But, and it wouldn't totally replace the existing licensure for military members, but it would give another opportunity for those individuals to practice by that means. There are some things to work out. Currently, right now, as a public protection agency, we provide protection to the public in part by our license verification portal. That if someone wants to know if someone is licensed by the BSRB, they can go to our website and check, and they can see any individuals who are licensed by us. With this, we're not really issuing them a license. And so trying to figure out how we can provide protection to the public to let them know someone is practicing, whether that fits within the license verification portal under some sort of a new naming mechanism or some other way, we're trying to work through that. Additionally, if individuals are practicing in Kansas, they would be subject to our unprofessional conduct regulations. However, if they violate something, it's unclear a little bit of the scope of our authority in terms of issuing fines to those people, or for individuals who are licensed by the board, there is the ability to suspend the license or revoke the license. This would be a little more complicated because those individuals are not licensed in Kansas. And so we're trying to work through some of those items as well. So made the board aware of that. I've had some conversations with our legal counsel. I've even reached out to some other agencies here in Kansas to see what they're doing. And right now, I think we're all just trying to make sense of this change in federal law. There wasn't a lot of detail that was put into that law in terms of some of these issues. So we're working through this and hope to have more information in the future. Also, one other item the board is working on, there was language in the bill that passed, I referenced to the bill 131, that called for the board to create in regulation a expedited application review process. This was not modeled after an existing process in another state. It was language that was added for the board to come up with a process. And so the board has been having conversations on that topic, but since we're trying to create it from scratch, it's been somewhat challenging to figure out exactly the language that should be used. And since there's 7 professions, it's going to be different by profession. But we had really productive conversations with the board, the most recent board meeting, and I think we'll have some language here for the board to review real soon. And then once it's reviewed and approved by the board, we can submit that through the regulatory process. That time frame, like I said, does take a little bit of time, but I think we're close to having something that's tangible for the board to vote on and move through that process. And then just before I end my report, I want to make you aware of a couple of items that have come up here recently. We did have a couple of unique meetings this past week. A couple of the advisory committees and some of the board members had asked questions about if we plan to have any roundtable discussions for educators. And in doing some research before my time, many years ago, the BSRB had some roundtable discussions with members of different schools here in Kansas that license some of the professions that we regulate. There has been a growth in professions and a growth in the number of programs at schools. And so in trying to figure out how we can accomplish the same goals that the roundtable discussions used to serve, we thought we would go ahead and try to do a similar type of meeting, but hold it online to reach more individuals. And so we had an informational forum for educators earlier this week, and that was on Tuesday for about an hour. And also in terms of our discussion here in the office, it occurred to us too that there have been quite a few substantial changes in law in the last 3 years at least. And some individuals who are at some of those programs may not be familiar with some of the items that we work with here in the office on a day-to-day basis. And so before we really have some concrete discussions about items that may need to be changed, it would be important to make sure that we're all on the same page concerning where we're at today after all these laws have been passed. And so I put together about a 35-minute presentation and walk through some of the significant bills that passed in 2021, 2022, and also 2023. I provided some information on some of the multi-state compacts that we're now a member of, some of the changes to things like supervision, out-of-state temporary permits, the length of time for temporary licenses, the availability of doing supervision by televideo instead of just in person, because there really have been quite a few really positive changes that have occurred. And so the information that was presented to the different groups earlier this week, it was well received. I will say too that in trying to reach out to representatives from all those schools, we found an old contact list. We knew it was likely outdated as some individuals had changed between schools. So we used that as the base. And then we followed that up by trying to reach contacts through the schools. We realized that we probably had missed some individuals. So we communicated to people that we didn't want this to be a one-time conversation. We wanted this to be the first step. And so we hope to use this and then build upon it in future meetings that are similar to this. And additionally, we talked about, based on time limitations, we'll talk about the statutes at this meeting. Maybe we'll have something in the future that talks about some of the changes in regulations. And then we can have a conversation about, trying to hear from individuals and learn about what's important at the schools and some of their thoughts in terms of maybe some of the struggles or some of the interesting things that they have experienced that I think would be helpful for the board to take into consideration when having the discussion. Similarly, the day after we had the educator forum, we had one for employers. We had heard from some of the advisory committees that it would be helpful for the BSRB to be reaching out to those groups, and I thought that sounded like a great idea. And so we tried to come up with a list of contacts from a lot of different facilities that employ mental health professionals in Kansas, similar to the educator list, but a little bit different. There was never, to my knowledge, previously a meeting like this between the BSRB and employers. And so we made that list up completely from scratch. And we tried to think of different entities, but we realized that we've likely missed several. And so we want to use that as the base and continue to add to it in the future. So if you do hear from someone and they said, I wasn't invited by the BSRB, it definitely wasn't intentional. It was just our attempt to go ahead and be proactive and reach out to people and then build on that in the future. But we got a lot of positive comments back from that employer informational forum as well. So we hope to have another meeting like that at least next year, if not earlier than that. So with that, I think I will go ahead and end my report and then answer any questions.
Thanks, Dave. As always, great deal of information. Any questions from the committee? Okay, don't see any, so we'll move on to updates from the Association of State and Provincial Psychology Boards annual meeting.
Yeah, and so as a composite board, we belong to several national associations. Some of those, one of the main reasons why we are a member of those associations is to be able to use the examination as a way to standardize who we are able to license in the different professions. And so one of the associations that we belong to is the Association of State and Provincial Psychology Boards, ASPPB, and the annual meeting took place at the end of last month. I'm happy to report that I was able to attend that meeting. Richard Nobles and Linda Heitzman Powell, who are the two members of the board for the licensed psychology profession, were able to attend that meeting with me. I thought it was a very helpful meeting to kind of talk about a lot of different subjects relevant to this psychology field. One item that we have talked about as an advisory committee in this group is standardization of licensure for master's level psychology programs. And the APA has been working on standards for accrediting master's level psychology programs, and they're moving forward on that. To be helpful with that, the ASPPB group has put together a task force and attempted to find commonalities somewhat, but also have brought some psychologists from jurisdictions that do not license the master's level to try to see what may be helpful in terms of a system that they may be interested in moving to should they wish to license the master's level. And so Kansas is one of 17 states that currently licenses master's level psychologists under that name or under others. And that is one of the issues for individuals who want to come to Kansas from other states or vice versa, is that there's not a lot of consistency between terminology for individuals practicing master's level psychology. And so ASPPB had put together a task force. The task force is not done, but they did release some preliminary, maybe I'll say this, they had a preliminary conversation with the attendees to kind of let them know what some of the topics were they were discussing. One of those items that they discussed was the usage of the EPPP. And just to frame this conversation to you, I should say, one thing they talked about up front was that this task force is intended to try to be helpful, but whatever final recommendations the task force reaches, it is not intended to be a system that everyone would need to move to if they want to license master's level psychology. It would be more of sort of a model law that individuals, they would maybe recommend to states to do so that there's more standardization. But they said if other states are doing things differently, they don't have to switch to this. But some of the things that they talked about was usage of the EPPP. And for the licensed psychology profession, it had been discussed last year that the EPPP and the EPPP2 will be sort of considered part of the same test as of January 1st, 2026. And the EPPP that has been historically known will now be referred to as the EPPP Part 1. And then the EPPP Part 2, that is currently optional in jurisdictions, will be considered the Part 2 of the EPPP. And so as of January 1st, 2026, any states that want to continue to use the EPPP for licensing, if they want to use it, will have to require both Part 1 and Part 2. But this is a test that was developed for independent clinical PhD licensed psychologists. So the question has been, what would be recommended for master's level programs? And for Kansas right now, if you want to practice as a master's level psychologist, the pass point that we accept is 400 on the EPPP. If you want to become a licensed clinical psychotherapist, the clinical level of the master's level psychology profession, you would need to have the additional postgraduate hours, and you would need to attain 500 on the EPPP, which is the pass point for PhD level psychologists that are licensed psychologists. One question was, since this is developed for independent practitioners, would both Part 1 and Part 2 need to be required for master's level psychology applicants? And one of the findings right now, at least the initial conversation, is that yes, they would want to keep the EPPP consistent, whether it's for PhD level licensed psychologist or for master's level psychologist. So after January 1st, 2026, they would want to require both Part 1 and Part 2 for both professions. Additionally, the pass point would not be the same for licensed psychologists and master's level psychologists. The pass point they would recommend is 450 for master's level practitioners, both for Part 1 and for Part 2. And in talking to Leslie Allen and a little bit of the historical context, it appears that for the EPPP, that is what has been recommended in the past, is the 450 pass point. But Kansas is able to have the 400 level pass point. And at this conference, they also shared that there are some jurisdictions that license at the master's level that have a pass point as low as 250. So I think there is a preference to go ahead and have that elevated to have more standardization, if nothing else. One of the other items they talked about, which was a little confusing, but as best as I could track that conversation, the scenario that they were putting forward for licensure of master's level psychologist would be having a limited scope of practice. And so you would have essentially tracks that you would follow as a master's level psychologist. And so, and if I recall correctly, and I may be slightly off on this, but I think one of them was more so on assessment and one of them was more so on treatment. And so, but I believe that they were intending to look at it from that perspective versus someone who would have the same scope of practice on a supervised level or on a limited level. And so that part was not fully resolved. It was a little confusing during the conversation, but that's what I was picking up in terms of what the recent discussions were. And then in terms of the naming convention, that is something that they were seeking to standardize too, because there are other states that license at the master's level, but they don't use the term psychologist. And here in Kansas, the clinical level, there was a great deal of discussion when master's level psychology was initially licensed at the clinical level about whether the term psychologist could be used. And that's why there's the licensed clinical psychotherapist naming convention. And so one of the initial points they were talking about at this conference was that they did not want to recommend usage of the word psychologist. And it's unclear what the alternative term would be, whether that would be practitioner or something else. But unfortunately, I think that still leaves a lot of states into the position of the public not fully understanding what that individual would be practicing. And so I shared some thoughts with the committee in terms of our state, and that we are able to license master's level psychology, that we currently have between the two levels of licensure about 600 individuals, and things seem to be working well here. And so a lot of things that they were at least discussing or possibly close to recommending would be difficult for us based on the differences that we have versus what they were speaking to. And they were receptive to those comments. I think it's just a difficult field right now because the states that don't license the master's level, some of those seem very dug in and very entrenched that they do not want to license the master's level. So I think they're trying to weigh different priorities here, and long story short, to be determined. But I wanted to give you an update because it was one of the sections, and they did open up for questions and a lot of really interesting thoughts on that topic. Other issues were also interesting at the conference, but I think for the sake of time, I'll go ahead and limit that. But I did want to share some thoughts based on the work of that task force so far.
Thank you, Dave. Comments or questions? All right. We can move to old business then. Our first topic, the continued discussion of recognizing APA accreditation from LP programs as satisfying accreditation standards for master's level psychology applicants.
Yes, and we did talk about this topic at previous advisory committee meetings. We have had some individuals who have not come from master's level psychology programs, but instead have received education through PhD level programs and would like to be licensed at the master's level. And these PhD programs are accredited by APA. These might be some individuals who have struggled to pass at the 500 level for the EPPP, or for one reason or another, that they are pursuing the master's level license. And the question has been, if the advisory committee is supportive of recognizing, well, so I'll frame it this way too. I know there's some newer members of the advisory committee as well. So for a licensing perspective, when someone applies for licensure, for some of the other professions, there is a national accrediting body, and the vast majority of programs seek accreditation through that national accrediting body, and they're able to do a lot of the checks and verifications of coursework and program requirements, so that when someone applies for licensure in Kansas, if they're accredited by that national accrediting body, we can move those people through licensure very quick in most cases. For some of the other professions that don't currently recognize the national accrediting body, master's level psychology being one of them, and addiction counseling at the moment also being one of those. If it's a program that we have done the review of and verified that they are consistent with the standards for licensure in the state of Kansas, we can move those people through more quickly. But if it's someone from a program we're not familiar with, often what we have to do is contact an expert and have them do a review of the program to see if it meets the requirements and the statutes and regulations, or the coursework to make sure that that is consistent with what's required for individuals applying for licensure. And that can lead to additional time, and that can slow the process. And we would like there to be more standardization as well, and make sure that people are moving through the process quickly. And so that is part of one of the reasons why this was a topic of conversation, in that would it be appropriate for the master's level psychology advisory committee to recommend to the board recognizing APA accredited programs as satisfying the licensure requirements, at least in part. And there's two real issues for this. One would be is that if someone came from an APA accredited PhD level program, would that be sufficient? Or alternatively, would we want language in the regulations that says they would come from that program that would satisfy the program level review, but then separately, would they also need to satisfy what we currently require in terms of coursework for that person to have done to seek, to obtain licensure? And so Leslie Allen included a document in your packet for today, and that is a draft copy of KAR 102-4-3A education requirements. And if the document looks a little messy, it is because the advisory committee has previously made some recommended changes to this regulation, and those recommended changes are making their way through that process, but they have not been finalized yet. So you may see a few of the strike-throughs still in that copy of the regulation. We have tried to remove a lot of those out so that you would see what it looked like when those other changes were finalized, so that you could just concentrate on these this new language. But I'll share a copy of my screen here. This is a copy with some highlights from KAR 102-4-3A. And the new language that Leslie has put together here, part of this is on page 9, which would be under program requirements. And so with the new language, it would say, in order for the applicant to qualify for licensure, the educational program completed by the applicant, previously it said they would have to meet the following conditions. This would say they shall be accredited by the American Psychological Association or meet all the following conditions. And then Leslie, did you want to share anything about this language here?
I don't think so. It's this way they have to show that they have the 750 hours in practicum, and they have to show that they meet all the coursework requirements for LMLP. It just allows us to not have to review the program, which is the longest part of the review.
And Leslie, I'm sorry, I didn't preempt you with this question, but if someone were attending the PhD level program, do you know if, let's say in the first 2 years they are attending that program, if the types of courses they take in those programs are similar to what is required for coursework for master's level psychology?
I can't say specifically. I mean, when we get people who have passed their comprehensive exams, that's what I see for doctoral students. So I see them when they're much further into the program than the beginning.
Lauren, you had a comment?
Yeah, I was gonna say that because the doctoral programs are longer, there is more flexibility on what years you take each course. And so if the person completed the entire program, and let's say their ABD, all that didn't get done was their dissertation, we'd know they'd completed the 4 years of coursework that includes all of the requirements because they're already APA accredited. What I think, if they're dropping out of the program, we would have to look at their transcript in order to know if they'd taken the required coursework in year 1 and 2 of their PhD program. Because if you don't get the degree and we don't look at the transcript, we don't know if you've taken 1 course or 20.
Leslie, typically are these individuals who have completed all of the coursework of their PhD program, or those who've completed the first 2 years and maybe have earned a master's along the way?
So it's either someone who's in a PhD program but received their master's degree in the program, or they're students who've passed their comprehensive exams and want to come to Kansas while they do their doctoral internship. So they want the LMLP.
Which it sounds like in both of those instances, the person has received a degree. Right, the only exception would be the ABD candidate, who I would argue is probably qualified for LMLP. If the only portion of their doctoral program they were not able to complete was their dissertation, they've at least met the master's level standard if they've passed at the appropriate EPPP level.
Other questions or feedback?
One suggestion I might have is that it might help make this decision if we looked or got the course description to understand maybe one of our local programs, like maybe KU, and look at what is standard coursework in year 1 and 2 of a PhD program. It may be so standardized in some programs that they could be auto approved, if that makes sense. Like if we know that KU and trying to think of the next closest clinical program, Springfield, you know, if we knew that they always required all of the core requirements we ask LMLPs to have in their first 2 years of the program, then that we'd know that anyone that had completed those 2 years.
But the
I
regulation
still feel
doesn't
like,
really
don't we
allow for
need,
that.
don't we need to make sure they passed those courses?
Yeah, so in order to get a license, they either have to have their master's in psychology or they have to have been in the doctoral program and passed their comprehensive exams. So they can't just apply after 2 years. They have to wait until either close to the end or when they have their master's.
Is the,
And the master's is in clinical psych, not, right? Like we would not want people with a master's degree in social psych qualifying for.
It doesn't specify that it can't be in social psych, but usually the coursework doesn't meet.
Right, like the PhD in social psychology at K-State, for example, would not make someone eligible to be an LP in the state of Kansas. And so I wouldn't want people who kind of quit PhD programs halfway through to think, well, if it was in any of the schools of psychology, it needs to be clinical psychology, not
So Dave,
not some of the other, like social psychology. A PhD in social psychology does not translate to an ability to practice in Kansas. It's not a clinical degree.
well, they don't have to have a clinical degree, but they have to meet the coursework requirements. So
Right, like I could go get my PhD in social psych, and because I already have an LMLP license and an LCP license, I've taken that coursework, but the coursework that K-State offers in that program is not clinical. So it wouldn't make sense for us to auto approve it, if that makes sense.
right. I've never had anyone apply from that program. So
Yeah, I was just thinking maybe that's a part of the answer, is finding the most common programs you're dealing with, Leslie, and making sure those have coursework in the first 2 years. So this hardest part only has to be done on people who are coming from schools we're not familiar with.
we actually do that for programs in our state. Like we've reviewed the master's, excuse me, the master's in counseling psych from KU, and their coursework has been approved. And so they're automatically, we make sure they've taken those courses that they have to take, and then we approve them.
Right.
Leslie, those programs that are APA accredited, is part of that process to get that level of accreditation from the APA that the coursework obviously meets a certain criteria, but does it occur in a certain order, or does it just have to, during the course of the program, they have to get through all those classes?
I am not that familiar with APA requirements. I'm sorry.
Seems like that, because if they say, look, during the first 2 years, in order to be APA accredited, you have to do this, and that meets ours, this becomes a pretty easy task.
Mhm.
But if they say, you have to have all these courses, but we're not particularly going to dictate when they're taken, then we could have somebody who might end up partway through their program and not having the programs, the classes that we require.
Yeah. But so the way we have it listed in this regulation is that they still have, the regulation starts with the coursework. So they still have to meet all the coursework requirements and the practicum. This only changes the program requirements in the university. Because if they're APA accredited, they'll have, you know, regional accreditation and all of that. So this doesn't change the coursework. It only lets us move faster for the program requirements.
And Leslie, there's basically, if this is something the advisory committee did like and wanted to recommend to the board to consider, there's two main possibilities here, right? You could either just modify the program type requirements here, whereas both the program and the coursework requirements would need to be satisfied separately. So it would change the current analysis of all the coursework. Alternatively, if it was found that, you know, those courses were consistent with these programs, and so if someone came from a program that was APA accredited, you would no longer need to go and double verify the coursework. Then potentially language here could also be added to the section that talks about courses that would say you either needed to come from completed a program from that was APA accredited or satisfy the following coursework. That's kind of what you're saying. So option one or option two, but it sounds like we probably need to reach out to some schools and just get a better idea of those things that are required.
Any other feedback?
The other common program in our area is a PhD in health psychology, and that's a large number of the LPs that we license. So it might be good to look at UMKC's health psych program. It's APA accredited, but another opportunity to kind of look at what years people are taking their clinical coursework versus doing research.
All right, very good. We'll now move to a continued discussion on KAR 102-4-13, use of computerized psychological tests. Dave and I talked about this. One of the good things about it was that it used relatively broad, innocuous language. But there were a couple of issues that probably needed to be tightened up. One being the highlighted area for the standards for educational psychological testing. I believe the most recent copy of that is 2014, is that right? I wrote that down somewhere. Yeah, 2014 is the most recent version of that. The other question I had about this particular one was around, does it say in there that in order to do this, the person has to have appropriate training in the administration, scoring, and interpretation of whatever instruments that they're using?
I don't see any language like that.
Yeah,
And-
I was wondering if that was something we wanted to include, because I was surprised that it wasn't in there when I reviewed this.
And for some of the new advisory committee members, part of the reason we're looking at this regulation specifically is the legislature has charged us to review all of our regulations in a certain number of years and to have a report by 2026 that basically says whether the regulations are still necessary for the implementation of state law or whether they should be repealed. And there has been some conversation by the legislature, not specifically to the BSRB, but just for agencies in general, that they're not always doing their due diligence to review regulations to see if there's any outdated terminology, if there's any vagueness that should be clarified, or if there's any items that are missing. So we are trying to bring regulations before each of the advisory committees on a staggered approach over this time period, so that way when we get to 2026, we can present something to them. And we're doing our due diligence at reviewing all of these regulations. But so that's kind of framing initially where we brought this before the advisory committee to update. Last time this regulation was updated was 1997.
I would agree with you, Dave, that there needs to be some kind of statement about being able to have competency or have competency regarding the tests that are being administered. I was looking, you're looking at the current one for psychologists in the BSRB. I was curious what they had in theirs, but I'm not seeing anything in theirs either. So.
Yeah, I have a memory that this issue came up once prior to my time on the board, where someone with a social work degree was doing some testing and had been reported to the board, but ultimately their question was not whether or not the person was a psychologist, but whether or not they were appropriately trained to do the thing they said they were doing. And could they demonstrate that? And so it seems important to have in our regs language that reflects that. Anybody disagree? Please speak up if you do, because you're in tiny little boxes and I can't see you. Okay, so if we update the standards for educational psychological testing to the 2014 version, add the language we just discussed, and then Dave, you have highlighted in person.
Well, and Dave, I do want to ask you if there's consensus to add the language about for each master's level psychologist not to be doing this unless they are properly trained. The first section, section A, talks about what each master's level psychologist shall consider prior to doing each of the following. And then the section B basically says to utilize any of these, they shall also meet the following requirements. So I just wanted to clarify if you think the language would be appropriate to be added under A or B.
Seems like A. 'Cause that's when we're saying, should you be using these instruments?
Okay.
You can't see my head nodding, Dave, but yes, I agree with you. Tiny little boxes, yes.
Okay, so we'll have it listed as one of the items that they should consider as an issue prior to utilizing testing. Unless there, I guess what I'm looking for kind of from the advisory committee, if there's no objections to it, I think what we would reflect in the minutes was that there was consensus to go ahead and make these changes or recommend these changes be forwarded to the board for consideration. Okay, and then Dave, the item you talked about under section B, item 5, what that says is essentially to utilize computers in any aspect of psychological testing, the master's level psychologist shall also meet the following requirements. Number 5, make an explicit statement concerning the report as to whether or not the master's level psychologist has seen or examined the client in person. And the term in person is not defined in our regulations. And this was back in 1997 when this regulation was written. And so I'm sure they didn't envision what we currently have today in terms of technology. But since we don't have a definition of in person, I think that the question is that clear enough in terms of if they're in the same physical place as the person? Or does it matter if they're person to person in the same physical proximity or if they're just interacting by screen? Or is this item number 5 really about, did they have interaction between the master's level psychologist, or was the master's level psychologist just reviewing information abstract from any connected activity with the person? But the language right now just says has seen or examined the client in person. The question is, does this need further clarification? Or, and if it does, what language should we be using here or recommended language to change this?
I think it's pretty clear. I mean, I don't know how else to say that besides maybe face to face, but I don't know if anybody else has any other ideas, but to me, it seems fairly clear.
I would agree. I think to me, as I read it, in person means something different than like to me, if someone said this was face to face, I'd say, okay, I've seen your face, but in person still to me, at least in the clinical spheres I work in, say physical space.
I was kind of wondering if the point of 5 is to make sure we know if the master's level psychologist has actually met the patient or not, because sometimes master's level psychologists might be just receiving the raw test data and processing it. So it depends. Are they wanting to know whether we've met the patient? Which is an important question, right? Like the report should say whether you've met them or whether you're just like you've got the raw data and you're going to analyze it and give it back to a clinical supervisor. Do we think that's what they were getting at, or were they just are we thinking they mean in person or virtually?
I think that's what they wanted to know. I mean, I agree. I was thinking of using the wording direct contact.
The past tense made me think that too. Like, has seen them, kind of at some point in person. I think the tense made me kind of think of it that way as well. Have you seen them in person? Have you laid eyes on them?
Or communication, something with communication, maybe.
I feel like it may also be connected to CMS regulations. If we think about billing, it's not appropriate. Sometimes the master's level clinician is the one that's doing the entire interview, the entire test administration, and then writing the report, and then giving that to a doctoral level psychologist who signs off on the report and hands it to the patient. If that is some of what they're trying to get at, it is important for the report to explain who's met the patient, who hasn't, where the raw data came from, and who collected it. And I think that's probably all they want to know, all of those things in the report, because it changes from a billing perspective, whether that doctoral level psychologist interviewed the patient or delegated the interview to a master's level psychologist. That's a significant billing difference in reimbursement from CMS. So
I think most reports that I've seen and that I've written myself, I mean, people are really good about writing that, like just as the basic setup, you know, the client came to this facility met on this date, one-on-one, or you know what I mean? Like they describe the setup, and then, so I don't know.
Maybe before 97, they weren't so descriptive.
Maybe they weren't. I feel like we do a good job now of being.
Yeah, I
more
have not
specific
seen a
on-
report that lacked this
Yeah.
information.
Right. I can't imagine writing a whole report as if I saw a client face to face when I actually hadn't. Like that just feels totally wrong. And I don't know that anybody would write a report and make it seem as though they have worked with someone in person but actually hadn't. But I don't know if people are like that out there. I hope not.
In the healthcare world, I mean, I do see lots of patient was seen in clinic on this day for administration of, and that is language, but you're still in the body of the evaluation describing the part that the technician did versus you.
So
I
it's
mean,
really,
should we just end the period at client? Like, we need to know from the report whether you met them or not.
so that was part of the question was in, I think, back to Dave's point that when this was written in 1997, it seemed to me as I read that it was really saying, did you see the person, or did somebody give you this testing and ask you to write it up? But now that some of this may be occurring virtually, do we need to expand on the language to distinguish between those things that were done in person, which means we're in the same room, versus those things that may have been done via technology in terms of the interview or additional gathering of information?
Maybe it could say report as to whether or not the master's level psychologist has seen or examined the client and in what modality. Or I think we could literally just delete the words in person, and then no matter how you've met this patient, you're going to be required to specifically state whether you've examined them. Not whether the clinic examined them, but whether the master's level psychologist has examined them. Not just gotten a phone call report, right? And had somebody gather raw test data. But I would argue that you can do the interview portion of a psychological assessment via telehealth in a competent way.
Robert or Josh, feedback?
Yeah, I'm. It seems to me, and again, you know, it's a long time ago, that the spirit of the question is just explicitly state how you saw the clients. Did you see them in person? Did you see it? And I think that's, like, I think we've all agreed that that's important, but the spirit is just tell us how you saw them.
Right.
If it was, now maybe we can simplify that or make it a little less ambiguous. But to me, that's the important piece. That's what this is trying to advise people to do. Now there's lots of different ways now, and back in 97, it was probably, I guess, either phone or I don't know, Windows 95 or whatever that was at that time. And I think maybe we can, it's presented it almost seems kind of dichotomous because it only gives you in person. That's a yes or no question. Whether you've seen in person, yes or no. Maybe it might be a little less confusing if we say that, how they were seen, and then maybe list phone, telehealth, in person, just to remove any ambiguity. But again, not to overcomplicate it with a long answer myself. I think the spirit is just tell us how you met with this person. How were they evaluated? Which I think still has value. Maybe we could clean it up. I don't know. Make it less ambiguous.
Maybe just like define the evaluation procedure, or define. Sorry, I was trying to think of a simple way just to encompass everything, especially as things change too.
What about instead of in person, changing it to personally? Personally examine the patient or client.
I was thinking just where it says, make an explicit statement concerning the report, how the master's level psychologist saw or examined the client. So that way it gives the option for the provider to be able to state, they have to describe how they saw them.
Yeah, but what if they didn't? How would this tell them they have to tell us how they came to create a report on a patient they haven't seen?
Could we say the extent and the manner in which, or something of that
Yeah, I
nature?
like the manner in which, or the modality by which, or something like that.
The extent to, because if they didn't see them, then it's 0 extent plus the manner.
Yeah, that's a good word. And again, I think the spirit of the question is literally just, have you met this person that you've written this report on, or did someone give you the raw data and this is what you came up with? Which should all be in the first paragraph of the report anyways. But I think there are instances where master's level psychologists are taking raw data and putting them into computers and running down the scores and creating some reports that then the doctoral level provider involved in the case will finalize the report and send to the patient.
Dave, does that give you some help on crafting some language?
I think so. Let me take some of these comments into consideration, and I'll bring something back for you to take a look at and see if you like how it looks.
We're getting a little background noise from someone.
Yeah, Robert, I think it might be from yours.
I still think the easiest is to just delete the in-person part. Then they have to make an explicit statement about whether or not they saw or examined the patient. I think that's the spirit of what they want to know.
It's an interesting thing then, though, what does it mean to say they saw them?
Right, it means whether you were part of the interview or whether someone just came back and they were like, here's the waste score sheet, turn it into a report. Because you could be writing a report on a test you didn't administer yourself.
Right, so if you got rid of seen, it's asked whether or not they had examined them or not.
Which is like, right, that's what they're asking in 5.
It could just literally say that, right?
Right, like
Did-
just end the sentence at,
Did you examine this person, or did you simply interpret test data from this person?
I think that's what it says now.
So I do kind of like just striking the last 2 words in person.
Yeah, we're making it way too complicated. We just need to delete in person and then they have to say how.
See, I'm a very literal person. So when I say seen, I'm like, did they see them in the lobby? So that way it kind of gives it, just having the psychologist being able to explain, how this data came to them, what modality, how did they experience this information? So because we have very literal people out there. So they could say they saw them. Yeah, they were in the lobby, but I had somebody else do the interpretation. So I think we have to help define some of that for them.
Okay. What if it said whether or not the master's level psychologist has seen or examined the client and by what modality? I think somebody else maybe said that earlier, but that would encompass that point too.
Wonderful.
Perfect.
Such is the tricky work of writing regs and understanding the many nuanced meanings of words sometimes.
And now in 26 years, somebody's going to say, what were they thinking when they were considering using the term by what modality?
Yeah. Anything else on that particular reg, Dave?
No, I think that covers it. And like you said, Dave, one of the nice things about this, which surprised me, even though it was written back in 1997, a lot of the language was written broadly and was not specific to then existing technology, which was helpful in terms of what needed to be updated. So.
Very good. All right, that takes us to the unprofessional conduct regulations. Both, I think our role here, Dave, is looking at those from the that relate to our own profession, but also reviewing those from the other professions to see if there are things that they have included in theirs that we think we might want to add to our own.
Yeah, that's exactly right. Each of the advisory committees did spend the time going through their own unprofessional conduct regulations, and every profession has a separate list. And each of the advisory committees made recommendations to forward to the board on proposed changes. And then when the board received those, there were several differences between professions, and those were sent back to the advisory committees as sort of a combined package. And you have a 42-page document in your packet of material. And it really is just each profession set of unprofessional conduct regulations marked up in red with the proposed changes. And the conversations were different between each of the advisory committees. And there may have been some items they discussed that this advisory committee did not. There may be some items that are unique to those professions, but the thought is maybe there are items that other committees recommended that when you see what they put in their unprofessional conduct regulations, you may think that would be helpful to have in this set as well.
And as we've talked about many times, this helps us all understand the difficulty of the work that Dave's staff have when all the regs are different for each profession. So it makes it a little more, actually a lot more complicated as they're going through specific complaints. But let's just start. Page 25 is where the master's level psychology unprofessional conduct regulations begin. I'm not going to go through this line by line. We don't have that kind of time. In fact, we're down to half an hour. And this has been on our agenda a number of times, so it's important that we try to get through this. So if you have feedback for anything that's on page 25, this is your opportunity to bring that up now. If not, I'm just going to move to the next page and we're just going to go through it like that. 25, going once, going twice. All right, page 26. Under item 11, it says treating any client, student, or supervisee in a cruel manner. I wondered if cruel should just be replaced with unprofessional. It seemed like you can do a lot of unprofessional things that wouldn't necessarily be cruel. It seemed like an odd. Everybody okay with that?
Yes.
Okay, number 12. It does not include sexual orientation in that list. I don't know if there were other descriptors people wanted to include in that list.
And I'll go ahead and share my copy of these marked up regulations. That way everybody can kind of follow along on the screen.
Are we okay with including sexual orientation? Head nods. All right. Anything else anybody wants to add there? Okay. See the changes that have been made to 14. Moving to 20. The use of the word secret as opposed to something like confidential information. I think it's used twice in that sentence. Seems like a...
Yeah, that sounds outdated.
And there was another profession, I think, that had recommendations on that point, but I don't recall which profession it was.
Okay.
I'll take a look if you want to keep talking about other topics.
Okay. Anybody have anything else on page 26? And you're going to have to speak up.
Seems like you can just take secrets out because it says confidences, so I would just delete that.
I'm not even sure I like that word too much.
I could maybe see how someone would believe that most adults generally know what a secret is, and not everyone might know what a confidence is. And maybe this was intended to just make sure people knew the like that includes any secrets you tell too. That's the only thing I can think of. It's weird to have it in there twice for sure.
What if we just have it as revealing confidential information of any client?
I like that. I think confidential information is a term used so frequently in healthcare that people know that. I guess the other analogy people tend to use is privileged information, but I think that muddies it, or could muddy it.
Yeah, I mean, that does have a specific meaning from a admissibility and court perspective, whereas confidential would be a broader term.
Mhm.
Any other areas on page 26?
So just to make sure, for an item number 20, which was the consensus that it should be revealing confidential information? And how would we put that?
Of any client, just insert confidential in front of information and delete confidence and secret. And then basically do the same thing later in the sentence.
I'll make a note to go clean that up, but essentially revealing confidential information of any client, except when any one of these conditions is met.
Yeah.
Well, I don't know if it's needs to be retained, but the or failing to protect confidential information contained in a client's record. I guess
Yep.
revealing or failing to protect, I think are different.
I agree. I like keeping both those.
I
So
agree.
it said revealing or failing to protect
Right.
confidential information.
In a client's record or in clients and records.
So I think it has to be kept grammatically the same as it is, and just you need to put confidential information twice.
Okay.
Revealing confidential information or failing to protect confidential information contained in a client's record. Because the first statement is a lot more broad in terms of information they may know, but isn't on the client in the client's record per se.
Yeah, I like that.
Anything else on page 26?
Clean that up a little bit more.
Page 27. Like, question
22.
about what?
Sorry, 22 had similar language secret of. So it looks like we had already covered a similar regulation that did include the term secrets previously. So replace that with confidential information.
Very good. 25. I wondered about adding something that said refer to the use of medicine that might create impairment. So they might not be drinking, they might not be using it illegally, or illegally using a controlled substance. They might be using a controlled substance in a legal matter. But what if it's, I guess the indication is you can't, just because you're getting it prescribed, use it if it's impairing your ability.
So Dave, were you talking about just removing the word illegally?
Well,
Using substances that could impair your, could compromise your, I mean, even thinking like DUI, right? Does it really matter if you're drunk or high or whatever is causing your impairment? You're not allowed to drive if you're impaired.
yeah, because I assume you could use a controlled substance for some people and it not impair them when they can.
Right, it depends. Yeah, there's lots of different controlled substances and they sure are at different levels of impairment or none, right? We think about a prescribed stimulant, probably okay.
Yeah, like an ADHD medication would be a prescribed stimulant that presumably is used to actually improve someone's ability to perform their duties.
Yeah, it's designed to decrease impairment, not cause impairment, but we certainly know which classes of drugs, which classes of the controlled substances that do cause impairment, but I think we just don't want people impaired by any substance that could compromise their I don't have a good word for that. Judgment.
Compromises the performance of their duties.
Yeah.
Or you could say practicing in an impaired manner because of using alcohol or controlled substances.
So I think
Should that be any substance?
well, so if I'm looking at this very literally, I think we're maybe adding something to the existing language, because what this just on its face says is using alcohol or illegally using any controlled substance while performing the duties of the master's level psychologist or clinical psychotherapist. So there's no language as it's currently worded that talks about having to establish that use of that resulted in an impairment of your ability to do things professionally. So, for example, let's say if you had someone who was practicing and they had alcohol in their workspace and they said, oh yes, well, I was drinking alcohol, but it wasn't impairing my ability. So if we add language like that, potentially we might be in a position to have to prove that not only were they using those substances, but that it was causing some sort of impairment of their ability. So just something to think about.
Well, and I think my ADHD example is actually bad because presumably that wouldn't be illegally using the controlled substance.
Yeah, I think you did that because I had tried to get us away from the word illegally, because you can legit be prescribed something that you should not be taking while you're practicing. And I know that that is not what the system or what that particular sentence is saying. But I think if we were in court, alcohol is legal. That's the reason it's listed as the example. There's a lot of things that are not yet controlled, like some of the newest K2s and spice are not yet controlled substances or illegal. But they're as bad as alcohol if you were to try to practice with them. So do we think this sentence is trying to get more at don't break the law, or don't break the law at work? Not we want you sober?
Well, it's almost like there's two things, as Dave points out, that this one doesn't talk about impairment. What I was adding was you could be taking a medication. I have a bad neck and on occasion I take Flexeril. Wouldn't be good for me to try and do much of anything while I'm on that medicine. Other people might not impact the way it does me. So maybe trying to add the impairment piece needs to be done separately.
Yeah, because I think both of those are good items to make sure that are covered. I just think if you do add it to language here, and this was found to be a violation by somebody, potentially if they requested a hearing, I think our legal counsel would not only have to prove that there were alcohol bottles in the office, but also that they would argue, well, yes, they were present, but it was a long time ago, so it wasn't causing me any issue when I was actually helping those people or something like that. So just things to weigh, or actually what the unprofessional conduct regulation is actually attempting to help deter people from doing too.
Very good. In the interest of time, anybody have anything else on page 27? Hearing none. Let's go to 41. Failing to seek continuation of service or abandoning or neglecting a client under or in need of professional care without making reasonable arrangements for that care. I wanted to put including after hours. We referenced that previously, just as an add-on to that. Everybody okay with that? Trying to scroll, looks like head nods. Good, thank you. Dave, I wondered about 44 in terms of custodian of client records. That whole area around having a plan in place in case you die or become impaired, should that be included in this section?
It's a good place for it. Yeah.
Just to catch some of you up, we're trying to make sure that private practitioners have a plan in place for who's going to become custodian of those records if they were to, pass suddenly or become incapacitated. So that those records, obviously full of PHI, aren't just sitting in an office complex somewhere that gets sold or rented to somebody else, and now you've got a lot of information that's at risk, but really no one responsible for it. Next 47.
I'm sorry.
Okay. Yep.
The item, which was you said 40. 44.
Talks about is the owner or custodian of client records.
Yeah. So there might be some good language on that on page in your packet on page 6, and maybe I could pull some of that language over to this item. On page 6, it's language that basically is it's going to look a little bit different because it's part of something that just talks about record keeping in general, but it says if a practitioner is the owner or custodian of the client records, it is the practitioner's responsibility to identify an alternate custodian of their records in the event they are incapacitated or pass away unexpectedly and there is no other custodian of their records. So I think I could take the intent of that language and modify it to match the style of this section, and that could probably be added to 44 to clarify that point.
Perfect. 47, engaging in a dual relationship with a client, student, or supervisee. I wondered about adding the language an inappropriate dual relationship. Those of us who live in rural and frontier areas know that sometimes it's pretty hard. I live in a community that's got one grocery store, and there are very limited options. So if you live and work in an area like that, you're bound to have some dual relationships, and obviously you've got to manage those carefully. But if we said to people you can't have any, I don't know how they would practice. People comfortable
Agreed.
with that? Everybody else? Head nodding.
I'm sorry, I forgot my camera was off. My head is nodding.
Okay. Anybody have anything else? Page 28. We're almost done. We've got 11 minutes. All right, final page 29. Wondered about under 52. It says offering to perform or performing any service, procedure, or therapy that adding the language the LMLP, LCP is not appropriately trained in or by the accepted standards. And or maybe, and or. But adding some language about you shouldn't be doing anything that you're not appropriately trained in.
Seems like solid advice.
Everybody okay? All right, thank you. And there were a couple of things I noticed in other people's professional conduct. One was around a section on social media. I think on page 35 and 36 of the counselor regs, there's a discussion about, there it is, number 56, 57. Obviously, again, that's something that's new in terms of when our regs were written the last time. So it seems important to include that. What do people think about this language?
Well, and if this is the first time you're looking at the social media language for item 56, I can tell you the advisory committees that discussed this did want to make a distinction between not forbidding the use of social media or even forbidding the use of social media in terms of practice, but specifically drawing a distinction between a personal profile versus a professional page or something like that. So when you see 56, it's very intentional that it says using a personal profile to do certain things.
That seems to make sense.
Yeah, I agree.
Maybe I just have never seen it before, but practicing inappropriate boundaries, is that a commonly used phrase that I'm unaware of?
Nope. The practicing word seems a little odd to me.
I would
Engaging
say
in
it's professional boundaries. I mean, I think the last ethics course I took for license renewal was actually titled appropriate ethical boundaries with patients. So it may be a buzzword or maybe just what that group was using, but I would say in like APA speak, we do talk a lot about boundaries with clients. And so maybe we could just clean
I think it's the word
that
practice.
up.
That's the word that I too stumbled on.
What word would be better?
Like engaging in
Engaging, yeah.
practices that cross, or I don't know. It's
Just engaging in inappropriate boundaries, I think.
Well, no,
even me.
his goal was to get the word boundaries out.
Well,
So
no, my goal
that's what I'm
wasn't.
saying. I couldn't figure out what we'd replace the word boundaries with.
No, I wasn't trying to get boundaries out. It was that I didn't understand how one practiced boundaries. Like, take out the word inappropriate and just say, well, I'm going to practice boundaries.
What
I
if
don't
it
think that's-
said, yeah, no, I
Demonstrate appropriate boundaries with
Yeah.
patients.
or failing to recognize appropriate boundaries with clients, something like that.
Professional boundaries. I mean, we talk about professional boundaries.
Yeah, that's what I was thinking. Professional boundaries is a word we use a lot. I had a nurse apply here recently that was fired from his last psychiatric hospital because he was exchanging Facebook messages with a former patient. And so that's probably not a specific nursing violation, but that violated the code of ethics at his place of employment, which then creates a professional boundary. So I do think that those are pretty common words in healthcare settings.
And then actually the next thing I had on my list was distance counseling, and I noticed that it's the next section here too, starting with number 58. We don't have anything in our regs up specifically speaking to that issue. Is that something people think would be worthwhile to add? Dave, can you scroll down a little? I don't know if that's the end of it there. Yep, okay, thank you.
I almost feel like that's a given. Right? Like informed consent is informed consent, and you're responsible for informing the consent regardless of your treatment modality, if that's virtual or in person or distance counseling, which I'm assuming is telehealth.
Yeah, I think to a previous point, you know, it's always, maybe always good to have things kind of specific.
I think what this was something that the APA was talking about, wasn't it? About telehealth and how to protect our clients and make sure that our clients understand the issues that could come with like Zoom meetings, you know, people popping into random appointments and having that understanding about all those things. So I think it's good to add to this as well. I do think that's an area of discussion.
By the way, the word I think we were looking for, we'll go back up, is observing, not practicing. If you made it observing professional boundaries, wasn't that the word you guys?
I think observing or applying boundary, you know.
I couldn't hear you, Robert.
Sorry, I said, I think observing sounds good personally. Applying boundary, you know, I mean, I think that was what popped into my head, but I think that's in the same.
Yeah.
And of course, changing the word inappropriate to appropriate.
Right, professional, professional. I thought you were-
For professional.
Yeah. Utilizing is another one of those words.
I like that. That's hard to confuse. I could see a case where we say, well, I didn't observe it, I did it myself. So, I mean, maybe I worked in psych too long.
Some people are very literal. So.
Yes.
Yep.
And again, this is the kind of work that if we do, it'll make Dave's staff, their jobs easier. If we're struggling with the nuance of the language now, makes it easier for them when this actually occurs in the future and they can say, this language is clear.
Mm-hmm.
And also for the public and licensees as well, for sure.
Yeah.
Yes.
We frequently get asked questions in terms of interpreting the statutes and giving legal opinions, and we can't do that. And so clean as possible is the best for everybody involved.
Exactly. I do agree with you. Because we asked practitioners, like, have you reviewed the regs prior to, you know, renewing their license? And so the more data we can provide them, the more information to keep them out of trouble, that's certainly our goal. All right, look at that. We at least made it through that, Dave.
Good job, team.
Okay. I did have a quick question. Did we finish with the continuing ed 102.4.10a? It wasn't on our list. But I when I looked back over my notes, I had some things scribbled in the margin and I wasn't.
I'll go back and revisit that, and we'll just bring it back for the next meeting just to make sure. I think some of the other committees are talking about those still as well, so we'll just bring it back for the next meeting.
Thank you. New business A, do you want to push that off, or do you have something?
I'll just bring that up real quick. So this is something that came up during one of the informational forums we had earlier this week, and I'll just set it as something for you to think about, and maybe we can talk about it at the next meeting. But currently, right now, individuals to get a master's level psychology license, one of the requirements is passing the EPPP at a 400 pass point. For a clinical level license, they have to get the 3,000 hours of additional experience and pass at a 500 level pass point. If they take the test once when they're going for their master's level psychology license and they get above a 500, that's great. They don't have to retake it when they have all their hours. However, if they don't, then they would need to retake it when they're eligible for the clinical level license, aside from passing at that rate. One of the people who attended one of the forums said they would like the ability to take the test earlier than having to wait until the 3,000 hours are accrued, because they said having to wait that long in between test opportunities, you forget some of the information that you knew the first time, and so your test score is likely to be lower. And so they would like the ability to try to get to 500 more quickly than waiting until all the 3,000 hours are accomplished. One of the issues with this is that the BSRB only approves people to take the test when they're eligible for licensure. And part of that is because those testing companies want to have valid data that the individuals taking the test are ready to get that level of license. They don't want people just taking the test just for the heck of it, even if they have the money. And so we're not able to approve people to take the test unless they are at that point to where they're ready to be licensed. And so this would be something different than what we can currently allow. But I can see both sides of the coin on this. And so I wanted you to think about it as something to prime for the next meeting.
Very good. And we wanted to look at a standard time and date just to add some predictability to your lives. What's the best way to do that? Do you want to doodle poll with some?
Yeah, I can send a poll out for the December meeting, and then also get some preferences from individuals in terms of a standard day and time that might work, so we can get meetings on the calendar for 2024.
Great. Very good. Well, thank you all. Very productive meeting. Appreciate your time and energy today. Have a wonderful weekend, and I'll accept a motion to adjourn unless somebody has something they want to add before we go. All right, motion to adjourn.
So moved.
Okay, David, I'm going to take Lauren as a second. All in favor, say aye, and we're just disconnect. See you all. Thank you.
Bye,
Thanks,
guys.
everyone.
Have a good
Bye.
weekend.